pandemic. Just to let you know as well, we will be recording this webinar for us to be able to view it and to share as well. And just going to continue on with that. The Secretariat for the GLC is Access Health, which is a global think tank, advisory group, and implementation partner. The webinar is an inaugural event under the newly formed GLC thematic area, People's Health. The thematic working group hopes to strengthen efforts in putting people at the center of health system decision-making by strengthening knowledge on and from communities that are often left out in their own health decision-making. As part of this effort, we believe that the climate health nexus is an important one that needs collective action and shared building of knowledge to mitigate and prepare. Our planet could see temperatures rise very rapidly in the next 50 years compared to the last 6,000 years. With that sort of acceleration, it's expected that there will be increasing negative impacts from climate change, including things like food insecurity, migration, inadequate access to clean water, changes in disease reservoirs. And these can worsen health outcomes in communities in the absence of mitigation and adaptation plans. The cost to humanity is expected to be an additional 5 million deaths between 2030 and 2050 from malaria, diarrheal disease, and malnutrition alone. Climate change will also force over 100 million people into extreme poverty, and an estimated 75 million people from Asia Pacific will be forced to migrate by 2050 because of this. Climate change also impacts marginalized and vulnerable groups adversely. It is with this context that we come today to discuss some pertinent issues at the nexus of climate and health. Very few people in the Pacific region will be unaffected by climate change, particularly as half the population live within 1.5 kilometers of the ocean. We speak first to Associate Professor Jemaima Tiatia, who is a New Zealand-born Samoan academic, researcher, mental health and well-being advocate. She is the University of Auckland's Pro-Vice Chancellor Pacific and formerly co-head of the School of Maori Studies and Pacific Studies at the University of Auckland. Today, we speak to her on bringing Indigenous approaches to viewing and understanding climate change and health from her work on Maori and Pacific Islanders. Professor Jemaima, over to you.
Thank you, Iman. That was a wonderful introduction. So, talofa lava and Manuel Levayaso Ole Ngangana Samoa. We are currently in Auckland, in New Zealand, celebrating Samoan Language Week. So it's very special for me today to be presenting to fellow Asia Pacific colleagues. I'll just get straight into the presentation because you've done the introduction. So I'll just share my screen. Just a few slides that'll keep me focused anyway. You can see that. Yes, okay. So what I'll be presenting in the next, I guess, 20 minutes or so is around climate change, mental wellbeing, and that nexus. And it was a project that I don't know what I was thinking because they're both giant topics. And when you do giant topics like that, you obviously need a team. And this team is star-studded. We have development studies, experts in climate change, a pediatrician, and people, in their relative parts of the world that have and postgraduate students. So there was room in the study to grow Pacific research capabilities and capacity. Whoops. Okay. Now, what was key about this is that it was Pacific-led and it was a Pacific-centered approach. For instance, in one institution I know, there are a number of Pacific-related projects, but at least 75% of those are not Pacific-led. They're actually led by non-Pacific. And so the amazing thing about this project is that it was quite the opposite. So, and the idea of that was to be able to privilege our voices, right? And put our voices to the forefront. We had research collaborators in the 3 sites, that being Aotearoa, New Zealand, Christchurch, to be more specific, the Cook Islands, and Niue. And the Cook Islands and Niue still have this free association with New Zealand. So they're still they're independent, but they are still under New Zealand administration. So essentially are still New Zealand citizens. It was funded by the Health Research Council of New Zealand, and we were able to get permits in both the Cook Islands and Niue to be able to carry out this research there. Of course, it takes a village to ever grow something and nurture something, as is the way for Pacific and probably most of Asia as well. It's never about the I, it's always about the we. And so with that, it was important that we had this group of expert advisors. We had Rossi Mesiapo and Niue. In the Cook Islands, we have a clinical psychologist and a marine biologist, both with PhDs based in the Cook Islands. And in New Zealand, we had Josiah, who is a mental health wellbeing expert and a youth advocate. And of course, Laura Tongalea. I don't think you can talk about mental health and wellbeing without also talking about addictions. So that was the makeup. So the aims of the study, rather broadly, is that, as I said, it was an opportunity to create space to privilege our voices and our worldviews. And then to explore whether or not there is a link between climate change and mental health and wellbeing. We know it anecdotally, we know it, but I don't think it's ever really been documented by a Pacific-led team. And so it was important for me and for us that we were able to conceptualize or define what this could look like for Pacific people in their Pacific context. And then, from there, be able to identify unmet needs and come up with some solutions that are very grounded and very community-based, more a bottom-up approach, that type of approach. And of course, with any research, the whole idea is to advance new knowledge, to inform, policy and design, and just to better support the mental health needs of Pacific communities, particularly if it has been climate-induced migration. And then, as we all know, being in another country and having to adapt at that level, that is coupled with lots of stresses, acculturative stresses, finding employment and housing and lots of things, and trying to fit into a culture that you wouldn't normally have known before you went into that country. And so the design of this, it was over a 36-month period, obviously a little bit longer than that because of COVID and border restrictions. So I wasn't able to physically go to Niue and the Cook Islands, but what was amazing is that we had research assistants based there, and they were able to do the work for us, which wasn't ideal, but it made complete sense. Phase one, it was in a couple of phases. Phase one, obviously, what is the evidence out there? Like, it was zilch, basically. And we did a Delphi method, and there was something like 70 panelists across the Pacific region. And there were a panel of experts that were either in mental health and wellbeing and climate change, or both, and could feed into what the priority areas are. So that's a Delphi method. Obviously, if you're not familiar with it, is a way of, you have a list of all these kind of questions, and you have three rounds of it going back to the same people, and it minimizes, and there you have your priority areas. And from that, we were able to then design the questionnaires for the key informant interviews with experts, and also focus groups with communities. And all that talanoa, all that talk, all that discussion, that rich, deep and meaningful engagement, basically the narratives and the Delphi method results, which is essentially quantitative, came up with these 7 areas, these themes. And these were across the 3 sites, right? And there is links that people were talking a lot about mobility and immobility. There are traditional knowledges and practices that we could learn from. There's still prejudice and discrimination towards what mental distress and mental health is, and still lots to learn. That solastalgia is a term that is often used. It is not Pacific. It's actually quite Western, but it's that yearning for home, or when you're at home or you're away from home. And so we wanted to flip that and try and come up with a Pacific kind of equivalent. So yeah, we're changing the narrative. Am I on time? Am I going over time?
Not at all.
Okay, excellent. So there's a few more slides left, and these were some of the voices from our interviews with people, and it was all about the land. And as you can imagine, the land has been likened to an umbilical cord. It is life-sustaining. It is, it is Mother Earth. It totally is. And so you had this is the narrative that you don't get too much of, right? In the climate change space when we talk about the Pacific. And so this is just about how deeply entrenched the land is to our people. I'm probably preaching to the choir here because it's probably the same for you. But you can see these are the narratives that we need to highlight. And in Niue in 2004, they were hit by Heta. And I was there last week, I think, and was able to go to all the villages and see the devastation since 2004 and still the lived trauma. There's such a trauma there that needs to be addressed, and people aren't willing to talk about it. How do we safely devise a strategy or some guidance where people are able to talk about it to therefore heal? So the study was able to, I guess, expose this gap and something we could work towards in the future. But you see, seeing your family wash out to see, their bones and burial grounds being uprooted, there is so much mana or prestige and connection and everything in the bones and our ancestors. And to see that devastation almost leaves someone with this loss and this no person's land. So I hope you had time to read that. It's important to this study that the framing was very entrenched in Indigenous and Pacific ways of knowing, doing, and being. So it was flipping the narrative on its head. And because it was Pacific-led, of course, the narrative should be just as, the same. And these were all conducted in the vernacular, and they were translated. So you can imagine this isn't entirely the depth of it, but it's just enough to be able to disseminate this information. And so what this is talking about is how important Indigenous ways of knowing and being is, and that the Western world could learn a whole heap from the Pacific in terms of the resilience and the adaptation. I mean, they're still standing, for goodness sake. Most of our vulnerable states and islands are still standing. It's like Auckland we were not prepared for our floodings. They had completely wastified us, not prepared. And it's like, well, we could learn so much. And of course, holistic approaches, and this is just an example when I was in the Cook Islands, and this Cook Island participant shared in terms of the way they brought 12 islands together. They talked about the most common thing that these different islands could talk about, and the Cook Islands, like 13 of them, was the pito, the ino, so the belly button, your gut, your center. And when you speak from that place of where your ancestors have come from, your health, that's the way you would think of health and mental health and well-being. So if you talk in those kind of narratives and come from that world view, you'll have better chance of meaningful engagement and being able to, I guess, work with some practical solutions. And currently what's happening now is that, it's more like climate change inequity and injustice. So these kind of narratives would hopefully help to dismantle or decolonize the current narrative. So in a coconut shell, my last slide is that we found that a recurring theme was that mental health and, the negative mental health bits and the positive mental health bits are still hidden. And we can understand why, because there's lots of stigma and discrimination around that. So it's going to take some time to break that down. It was pleasing to see that culture, spirituality, family, and community are still up there, and the connections to ancestors' environment are still emphasized. So that's very, very strong. So it's important then that we use these strengths to be able to work together and be able to find some resolve that works for everyone, mainly those who are experiencing adverse climatic events. And then all these other things, the linkages to economics and livelihood, workforce, all of this, we need deeper connections between these concepts and our world views. We know that climate change isn't going to go away, and neither is mental health challenges. So how can we put our front foot forward to be able to anticipate what could potentially happen in its stages? And number one finding for me is to continue to listen to the voices that are often not listened to or obscured, especially at international major meetings, major settings, and the ones that have been hit the hardest don't necessarily feature the loudest. So yeah, and that's me. So I appreciate the opportunity. Thank you.
Thank you so much, Professor Jemaima. That was, I think you've touched on all the most important points that we ourselves, as we've been trying to look at people's health, which is exactly why we believe that there is such importance in amplifying the voices that need to be amplified the most. And thank you for reiterating that. And I have a couple of questions which I will leave for the latter part during the questions and answer section. And then I think I'm going to move ahead with Mr. Sandaruwan as well. And just before I go in, just a bit of context. The Global Climate Change Vulnerability Index has ranked Sri Lanka amongst highly vulnerable countries to climate change in the world. And I'd like to invite Mr. Sandaruwan, who is a scientist working for Sri Lanka's National Aquatic Resources Research and Development Agency, NARA for short. Mr. Sandaruwan's experience lies in environmental, social economics, and marketing aspects of the fisheries industry in Sri Lanka, with a particular focus on understanding factors that influence well-being in fishing communities, sustainable development goals, gender factors, gender roles in the fisheries sector, and the relationship between fishing communities and natural environments. Mr. Sandaruwan will be speaking to us on his work in climate vulnerability frameworks and adaptation in coastal fishing communities in Sri Lanka. Mr. Sandaruwan, over to you.
Hello. Thanks, Iman. Actually, it's a nice introduction, and it's great privilege to talk this kind of audience as well in presenting with Professor J. The previous talk. Actually, when we talking about that, my work, it's totally depend on the yeah, it's okay. Actually, I'm talking about the climate change vulnerability assessment of marine fishery of Sri Lanka. Before I go to that, I want to show these diagrams and tables. Most people have doubt about actual climate change or climate change is articulated by scientists, and it's not real one. But these climate meteorological data shows that Sri Lanka facing huge problems with the climate change, especially in the rainfall, not the quantity of the rainfall. The pattern of the rainfall has been drastically changed in last few decades. As well, temperature also a big problem, and the number of hazardous events faced by Sri Lanka is increasing, especially flash floods, cyclones, and earth slides, flood events, those are increasing. And this is the Green Watch organization based on Germany. They every year prepare climate change index, and with consecutive 3 years, 2013, 19, and 20, they have ranked Sri Lanka as among the top 10 vulnerable countries. When we thinking about the climate vulnerability, it's not about the climate impact. Sometimes there are other countries facing more climate impacts than Sri Lanka. But when we're talking about the vulnerability, Sri Lanka is vulnerable. what is the difference between this? In the climate impact, we are talking about how many climate hazardous events faced by the country and what is the quantity, the size of the hazard and those things. But in the vulnerability, we thinking about how sensitive this population, as well as they have capacity to adapt these climate change. In that scenario, Sri Lanka is somewhat poor because when, for example, when hurricane hit America, a number of fatalities is much lesser than if Sri Lanka hit hurricane, because the America has great good plan and forecasting and everything. They get safety precautions before happen. But in Sri Lanka, we have not kind of system, early warning system. That's kind of thing. So we think our country is more vulnerable than others. As well, in the previously, most of the scientists talking about environmental scientists are the dominating in the climate assessment. But now we social science scientists take that part, because now people more concerned about what is the impact of the economy, sociology, psychology, and all the things. Because of that, now we have, as a socialist and economist, sociologist and economist, we have great role to play in this subject area. As well, in the previously, most climate change, when the conference and the big events are talking about the climate change, most of the people talking about mitigation, how we can reduce the temperature, how we can reduce the greenhouse gas release, and those things. But now we are talking about adaptation and resilience, how our communities make to prevent and take some action to face the hazardous. And after facing the hazardous, how we can convert them to back to get normal life. That's the very important things. In the resilience, we are talking about that. And therefore, vulnerability concept has three main subsectors: exposure, sensitivity, and adaptivity. In exposure, we're talking about the frequency and intensity of the stresses that occur as a result of climate change. In the sensitivity, we are talking about how sensitive people when shock hit them. For some time, the community is more poor and they have not much literacy, and they have not get information, and they have no ability to convert their current livelihood to other livelihood. Then they are more vulnerable, and the community has more disabled people, and they have no previous experience how to face this kind of climate shock. Then they are more vulnerable. And adaptive capacity, we are talking about how this community converted into face these shocks. For example, in fishing community, sometimes fishermen use one fishing gear. They are use one net or hooks or something. But due to this climate change, now they are diversified their fishing gears, and they have build up some infrastructure facilities and some financial assistance, build up the social network. That is the very important thing. When they are facing this kind of thing, they have to get the help from the other communities and the government support, those things. So it's the adaptive capacity building up is the very important. When we're talking about what are the risk factors we are facing, now our fisheries industry is struggling with prolonged drought period. Drought is, we are thinking about drought is very linking to the agriculture, but fisheries sector also, drought is very important. Because the post-harvesting loss also can increase due to the drought, and some illnesses, heat stresses can increase with the drought, and changing patterns of the rainfall. this is very big problem in our fishing industry. In previously, they have they have 2 monsoon season. According to that, they are have a different fishing season, and they are ready to get different kind of catch different kind of. Now these all the patterns change, and they cannot predict what kind of fish we are going to catch. And in the previously, they are preparing some kind of net, especially for this species. But now they are bringing this kind of fish net, but they cannot catch that fish. The reason is now our water temperature is different. Then fish is available in the different depth of the sea. As well as sometimes fish migrate into the different geographical area. In the previously, the fish species we found in the tropical region, now they are moved to the North Pole or South Pole because this temperature changes. Then they are facing very big problem to find out what kind of fish are available and what kind of fishing gear we should prepare. And the coastal erosion, when the coastal erosion happened, their land inside destroyed. Then they have to put many effort to land their boats, and changing word circulation patterns in the lagoons also a big problem. Then it's affect for the mangroves, then it's affect for the fish species. Then they have no much to catch in the lagoon. Most of the lagoon in Sri Lanka become unproductive now because of this kind of water circulation problems. In the previously, we have that lagoon mouth opening days, and then all the water flush out and the things. But now it's not happening because of that salinity level. Some highly salinite and some very low salinity. Then it's very difficult to get good production. So these are the problems. Because of these problems, they have increased uncertainty of the income. And some of them have injuries and deaths because they are facing some hazardous environmental events frequently in the sea. And destroyed infrastructure, reduced fish catch, and increased cost. This is a very big problem because to catch the get good harvest, they have to increase the number of fishing days in the sea. In the previously, some fishers terminate their fishing trip within 1 week. Now they are extended to the 1 month, 2 months, and they spend long time in the sea. Then finally, all the things have converted into the well-being problem, then we are thinking about how it's affect for the well-being. Actually, we know that income is directly related to the material well-being. Then income is not. They have a lot of problem, food problem, nutrition problems, and the things. And fish prices goes increase because we have to bear huge cost to catch the fish, and threat to the environment, and lose social connection and the things. Actually, I want to talk much more in here, the health-related issues in the fishing community facing, especially back pain and spinal cord problem. This is a very common problem because most of the small-scale fishers landing their boats using their backsides, and they pull board. Now, because of this soil erosion, beach erosion, they have to put more effort, and they have to push their boats very long distance. Then most of the fishers has that kind of spinal cord problems. And then skin diseases, sunburn, rash, cramp, and everyone has this kind of diseases. And fatal injuries because sometimes they have to repair their boats inside the sea, and then they are diving for that, and they have no any good accessories, and especially in the storm condition and the hurricane time period, then they have most of them experiencing fatal injuries in these times, and most of their dwellings, their houses also face flood events frequently. And these fishermen and their families face nutrient deficiencies than other communities, because you know that when the fishermen go to the sea, they are bringing very few amount of foods, but they have to stay 2-3 months. Then they have to limit the consumption of food. Sometimes they eating just only the fish only. Then all the things are finished. Then they have some nutrition issues, especially the big problem in dengue. Our medical research institute also show that the dengue fever, it's a pandemic, and it's because of this temperature and rainfall changes, this dengue pandemic increasing. And most of the fishing community has a kidney disease, because sea level intrusion, the saline water come to their well and some water canals, and their water quality is deteriorated. Most of them has kidney diseases and diarrhea, because that water level increasing, their water drainage problems and toilet water not difficult to drain. Then those are and flooding events, those are increasing diarrhea. And in the mental health, actually, we observe addiction to the alcohol and smoking drugs increasing, because of they are in the huge stress due to this climate change. They cannot predict their income. Their income is getting decline day by day. Then they are easily addicted for the alcohol and smoking. Then when they are addicted this kind of thing, domestic violence increases, especially women facing huge problems with this. And social transmitted disease. When the fishermen go out long time in the sea, then sometimes they cannot come to the house, and they landed their boats for a few days for the other fishing harbors. Then some kind of taboo sexual, the unprotected sexual interaction can be happen. And it's also increasing social transmitted disease among the peoples, and child abuse increasing among the fishing communities. We observe respiratory problems, cardiovascular problem, diabetic, eye problems, eye strains, eye pain, hearing problems. All the things are significantly higher in the fishing communities than other normal communities. Sometimes, but at this research time, I cannot statistically prove there is a climate change impact is there, but apparently there is a climate change problem affect for them. And they have to get the adaptation for this, and they develop some adaptation tactics. I'm not going to talk much because this time is going. Actually, I'm thanking to give me my chance. If you have any question, please raise.
Thank you very much, Mr. Sandaruwan. That was a really informative and a great look at a community that is close to my heart as well, fishing communities, because often I think, especially in Sri Lankan context, coming from a little bit of background from there as myself, is that in the planning process, we, even in healthcare in Sri Lanka, we don't look at them as a specific community. They live amongst the other villagers, and so the planning, the health services planning happens at, in terms of distance or whatever it is specified for geographic region, but we don't really take a look at fishing communities as a separate standalone community. So they are more alike across the geographic region of Sri Lanka between fishermen than the people they live with in their immediate villages, because of their unique livelihoods. And that is inherently connected to their culture. They have their own culture, and we don't really celebrate or understand that And I think that brings me back to Professor Jemaima's part as well. And just before I open it up to everybody else, I'd like to ask both Mr. Sandaruwan and Professor Jemaima, both of you have, I think, touched on the importance of understanding their vulnerabilities, which are unique, and on the mental health aspects, as well as the need for sort of either regional or more private-public interaction where they have a voice and their needs are amplified. How can we, going forth, sort of operationalize that? How do we build that? How do we build that space, and how can we do that? Over to you both. I'd like you to have a kind of dynamic discussion. So mic on both of you and go ahead. Yes.
Oh, okay. I'm just assuming it's okay for me to go ahead. Not that I know the exact answer, but obviously it's probably cliche, and something we already know is that if you don't have your leaders on board, then it is almost fruitless, because at the end of the day, they're holding the purse strings. And then, of course, we need spaces that are safe, and where we're no longer kind of marginalized or excluded from some of the bigger issues and debates that are going. And being able to be flexible in the different, you could say the same thing, but the flexibility to adapt to different audiences, whether they are diverse by ethnicity, and even within the climate change space, are we thinking to those with disabilities? Are we thinking to the rainbow community? It could just go on and on and on. So I guess I've always been about listening to the people, and you can only ever listen to the people in order to get something right. But you need those people at decision-making tables to hear those voices. And I'd like to think that research is that conduit that joins it together. But even better is that we need to be at those tables. We do in this room.
Mr. Sandaruwan, over to you.
Actually, Iman, in Sri Lanka, public health is somewhat good, especially midwife. That means they are very concerned about their community, and each village has a midwife, and they go house to house. I think this midwife and public health inspectors are doing great job, especially for these marginalized communities. For example, I will tell one incident. When I go to meet a midwife in down south fishing community, a woman is crying in front of her, and she is pregnant, and she is telling, I didn't do any bad things. Why? I don't know why it happened. Actually, I think she is positive with the HIV. She don't know how to get it. Especially it's got from her husband. He is a fisherman. In that scenario, that man is blaming for the woman. That kind of the gender gap especially gender gap exists in the fishing communities, because in Sri Lanka it's a fishing male dominating that activity. Then all the blames and the negative things goes to the woman. Then there is a huge gender issue inside this community. Then that midwife tackled this problem very strategic way. She bring those people into the free clinic and get the diagnosis test, and try to avoid the mom to children transmit HIV transmit, and she did lot of works for this family. I told that it's a one experience, how we can help them. And this kind of thing actually sometimes, because of, Sri Lanka is facing huge economic crisis these days. And so our government no more can invest money for that kind of investing toolkits and giving money, allocating money for that kind of public health activities, then we are reducing those things. That kind of service are not available anymore, or they have poor, they are deteriorating the quality of this health services. Then we are facing huge problem, especially this kind of marginalized people, because they are mainly depend on the public health. The rich people can go to the private hospitals and get the things, but in that fishing communities, especially most of the fishermen don't like to go to the hospitals. They are taking some home remedials and household prepared medicines, and until the disease is very difficult to cure, they stay home. Then it's very important to involve this kind of people. And another thing is that dengue and in the previous COVID-19 time, the public health inspector role is very important. Give the people awareness, and sometimes they have to advise thoroughly, sometimes get the legal action. Those things very important to reduce the spread of the disease. Still, there are a huge gap to provide health services for the fishing community.
Thank you, Mr. Sandaruwan. And just to echo with that, I think I'm going to open up for everybody else, but just to add on to what you said, in my own research with health services in Sri Lankan fishing communities, I spoke to a public health inspector, and he voiced out what you were saying as well. But one of the key issues that he had is that, and this is because it's pertinent to this conversation as well, is that he comes from a fishing village himself. And Mrs. Sandaruwan, I think you know the public health inspector as well. Whereas a lot of the other public health inspectors are biomedically trained and they live in more urban settings. So there is a clear disjunct between their approach in communicating with fisherfolk, and there's a preconceived notion about them because they're in Sri Lanka at least, and also elsewhere. Fishing communities are seen as loud, a little rough around the edges, and temperamental, and even arrogant, and that's that, and they can feel that as well. So when I spoke to fishing people as well, they feel like sometimes there is a disjunct in the respect and dignity that they get. This may not be inherent to the service providers, but there is that disjunct, and the public health inspector I spoke to understands that difference because he's from the communities, and he says that that's one of the things that is required, that there is an unknown disjunct between providers understanding them as people as opposed to them being as the other. And I think, again, this is something that's common, that we need to find a way to bridge that area in order to really see them through their own eyes. And with that, I'm going to stop talking and I'm going to open it up for everybody else. Please just raise your hand, and maybe Miguel will mic on, and whoever's mic gets switched on, you can ask the question directly to our panel speakers, please.
All right, maybe to start off, I think I do see some questions inside the Q&A section. So, okay, maybe to start off, the very first question is from Simin. So she says, thank you, both Mrs. Sandaruwan and Professor Jemaima, for those enlightening and heart-wrenching insights. And she would like to hear your recommendations as well, especially what should be prioritized in terms of actions.
Should I go? I'll just go. For me personally, and it'll obviously be different to my fellow speaker, it's more like, what can the system do? Like for mental health and well-being, how can our services be reconfigured to be able to cater or to attend to the mental health needs of climate migrants, for instance, for a whole heap of reasons, those who've been relocated. rather than it just being waiting until the it's the last straw and then something goes horribly wrong. Sometimes that distress can be addressed very early on. And for instance, in our justice system, the incarceration rate obviously is higher for those who are non-white, and that in New Zealand is mainly Māori and Pacific. And I say that because a lot of those people have mental health issues that were never addressed, and I'd hate to feel that our populations are impacted in some way because the mental health services were just not up to scratch and the health sector wasn't keeping up with the changes in diversity in our communities. That would be my number one. And workforce development, obviously you need more human resource to be able to carry that out.
Great responses, thank you.
Yeah.
Sandra.
Actually, in my perspective, when we're talking about Sri Lanka is a catastrophic area for the NGO projects. Most of the NGOs comes with that different issues, and they develop their own framework and come and started small projects, and finally most of them fail within 2-3 years without having effective outcome. If you want to solve this kind of problem, I think first is you have to hear the voice of the people and understand their real culture. Sometimes the solution you are given and articulated in your modern society or in the alienated outside system, they are not willing to accept. These people, especially in the fishermen, are highly traditional peoples. We difficult to get aware them sometimes, and that kind of they are don't willing to get advices from outside communities. So first we have to take their own community people's ideas and get prepare this type of activities as well. Sometimes solution may not be easy. We cannot get one activity project or something to solve this kind of problem. It may be not work. You have to understand all the dimensions and have to give the solution for all the causal roots. Otherwise, then only one thing is not happening. So I think this kind of activities we should implement.
Thank you, Mr. Sandaruwan. Just to follow on, I think one of our speakers, one of our attendees would just like to have maybe a summary of your adaptation slide takeaways, which were of interest, if I looked at the chat box, right? So maybe you could just...
I think everyone, Mr. Sandaruwan, I think there's also another attendee that was asking, requesting for you to share maybe your adaptation interventions. Along the similar vein. So I think that you could answer that maybe.
Perhaps a very quick run through just in the interest of time and to keep the discussion going. Also, I think while I was wondering, Jemaima, just as a follow-up to the question once Mr. Sandaruwan's done, is perhaps we could talk a little bit about decolonizing. I've heard and seen so much of it, but how do we actually go about doing that? That's something I'd like to maybe talk about as well. And I think it's so important.
Right now or after?
After Mr.
Okay.
Sandaruwan,
Yeah, sure thing.
Actually, in here, I'm presenting some different adaptation options developed by that within the community. They are diversify their fishing gears by themselves and increase capital investment because they increase the number of fishing days and the things. In some NGOs now try to give the GPS and fish navigation system to reduce the fish searching time, and then it's can help to short the fishing trips duration and reduce the cost. And some ecosystem-based management activities also happen, especially to avoid some sea level rise and some sea storm surge activity. Try to build up, try to cultivate mangroves, and some community groups helps to develop some kind of marine engineering architectural activities to avoid seawater come inside, and especially providing safety equipments. In the previously, most of the fishermen have no fire extinguishers and safety jackets. Now some NGOs and governments distribute those things, and our meteorological department try to build up an early warning system, especially when storm or hurricane is happening. They try to disseminate information through the SMS and radio channels, and introducing climate smart boards. This is a big project funded by FAO, still not going into the community level, still in the researching level. They are trying to develop some boards to avoid the fatal incidents in rough seas, and giving some training and awareness programs how to adapt for the fishing communities. Those things are happening in Sri Lanka.
Thank you, Mr. Sandaruwan. Great points and great adaptation techniques. And over to you, Professor Jemaima, just to speak on the decolonizing as well.
Okay, that's a massive question, and it's something that's probably been around for so long. But I do thank you for the question. How do we start decolonizing this sector or this area? I consider that one of the biggest things is anti-racism campaigns, because a lot of this marginalization and invisibility, the root of it is institutional racism, right? And that you know, we're too insignificant or under-resourced, or do not have the indigenous knowledge or knowledge systems that could are just as innovative. We've only ever heard one narrative or one discourse, and that has only ever been those that don't look like you and I or anyone else in this room. And that's it. That is completely it. Because if it were if it was an equitable world, we would be making decisions for our own people. But that can't happen as long as racism and power and control are very, very prominent.
Thank you. I think that's something even in countries where we don't really, or in places, in communities where we think that we are more alike with one another, there is a different sort of marginalization that happens. If it's not along ethnic lines, then it's along socioeconomic lines or even cultural lines. And this I've seen again with the fishing communities as well, which I didn't know existed, and I lived there all my childhood, all my semi-adult life. And it is only when you delve deeper, and to do that, you have to actually make the effort to go in. And so I think one run-on question, but before that, I'd like to bring in one of the attendees' question is, how does migration affect the cross-health of health and climate? So do you, in terms of migration, I think what the question was how do you think that migration is going to actually affect health?
Is that question for anyone? I think I might just pass it.
Directed.
Oh, right. Sorry, I don't quite understand the question. I can't see it. Where are we? Sorry about this.
If anyone asks a question, perhaps you can mic on and ask directly as well.
Okay, maybe while waiting, I noticed that one of the attendees' hands are up, so I'll allow them to speak to ask their questions.
Yes, please.
Okay, I believe the attendee is Dr. Krishna Reddy. So hang on, let me just unmute him. Dr. Reddy, are you well?
Yeah. I mean, this was not the question that I asked, actually. I just wanted to make one or two just comments based on the messages that came out of the panelists. Most strong message that came out, I think, is the health system's willingness to listen to the people's voice. And also the interface between the health system, the frontline health system, and the community. The bridge of that community health volunteer, I think that is the most effective tool well established in some of the countries, that a volunteer drawn from the community, interfaced with the health system, will overcome some of the disjunct which Iman has mentioned between the health system and the community. I think, yeah, this is the most neglected aspect of health system strengthening in the last few decades, is the ignorance of this. There is a term called community engagement in theory, but it's never institutionalized into practice as to what actually is the community engagement that system means. So I was impressed by this panel discussion, because these are the three critical messages, not just from the context of the climate change, but in terms of how you enable the resilience of the communities by listening to the communities and responding in a way that respects the tradition of the communities, their beliefs, not ridiculing a spiritual belief just because it is not scientific. I think that message came very powerfully from Jemaima, from the Pacific Islanders. I think it applies to not only the islanders, but everybody across the societies. The leaders who are supposed to listen to the communities and represent the voice of the communities, they stop listening once they get elected. So one of the action points should be that the leaders should listen to the community and then voice in the right fora where the policy making happens. I mean, these are just a few comments in response to the very excellent panel discussion. Over to you, Iman.
Thank you, Dr. Reddy. And just to continue with Dr. Reddy's thoughts as well, I think one of my questions to both of you is, so much of our conversations out there in the world is about bringing information and awareness to them, the others. But do you think it is pertinent and timely that we, the others, begin to learn how to think like them? And maybe that's one of the first steps we need in decolonizing, because we've got so much of language and thought processes that are inherently colonial and Western, which is not a problem, but it is just that we have other ways and more effective ways within our own languages that encapsulate and capture processes, feelings, emotions that is lost in translation. And do you think and see value in us learning to see that and to be able to learn to look and speak that language, as opposed to always trying to convert and translate into another language, but really situate ourselves in that? And I'd just like to ask you if you think that that might be a pertinent way to go about things in future, if we want to build systems and spaces for these groups.
Oh, 100%. I mean, you answered it so eloquently. That's exactly right. It is centering ourselves in a narrative that we've bought into for so long. And I know this may be, not everyone will resonate with this, but it is a woke culture. And, you know, woke culture stemmed from African Americans way back when. And when you're woke, you can't unsee it, or you can't unhear it. So when you're on that journey of knowing, you have the solutions. And the doctor that shared, it is the power in our words and the ways that we know it, and the concepts that we've spoken about, and the creation stories and our gods. And that we've been so indoctrinated to let go of all of that. And now look where we're at. So a reclamation and a re-indigenizing, I think, is a powerful thing in this space.
Thank you. And Mr. Sandaruwan, to you, I would like to ask, adaptation, you know, a lot of the times we from the outside of these communities, we talk about helping and assisting people to mitigate or adapt. But like you said, fishermen, fishing communities are so resilient themselves. Can we learn from their resilience? Can we learn from Pacific Islanders as well as fishing communities and other marginalized communities? Can we actually stop trying to teach them and rather learn from them? And if so, how do you think we can go about doing that?
Yeah, actually, I think we have a lot of things to learn, especially when I go to the field. I give more chance to talk them because they know many things. They are living with the environment, and they are struggling with many social issues. And when I work with computers and books, they have a real ground level experience, and sometimes I feel they are professors. Actually, the fishing community, one thing is we can learn from them. They are never give up. In the Sri Lanka, we hit 3 disasters in the continuously. That means COVID, then pandemic, then different climate hazards, and under everything. And the price is especially last 1 year, our fuel price increased 3 times. It's a 300% increase. It's a very difficult to bear someone. But until they doing fishing without giving up, sometimes they can. I'm thinking about how they are able to do that. They have some kind of resilience things within their community. Sometimes, for example, when we have no our staple foods, and then we are suffer this kind of foods we have not, but they have they can find different alternative food items from their environment. And sometimes they difficult to get help from the government, but they already built up their own network within the within their society to do the same things among them. They have some cooperatives, and some especially when they have good revolving fund systems, their own fund systems. Then where they don't in our commercial banks sometimes not recognize our fishermen. They have no collaterals to mortgage, or they have no some guarantees, but they have some their social safety networks to build up this kind of financial assistance. And there are so many things, indigenous knowledge they have. We are thinking about giving them GPS is a good thing, but looking at the stars and the wind patterns, they can find any place on the sea. Sometimes, without having any technological instrument, they can even go to Australia from the Sri Lanka, and some Madagascar. In the whole Indian Ocean, they are navigating without any problems. And sometimes if they are unable to find the fish from their traditional fishing grounds, they have common sense to find another fishing grounds. Sometimes it's very difficult to observe them and talking them to get the answers, but they are doing with their inherent knowledge. Sometimes so many variables involved to get this kind of sense, and we cannot catch all the sense. Then we can it's outsider, sometimes we cannot understand how they resilience.
Thank you very much, Mr. Sandaruwan. And I'm mindful of the time. We have moved about 8 minutes over time, but this has been an amazing, so insightful conversation. Thank you, Professor Jemaima and Mr. Sandaruwan, for taking time today. And I'd like to invite us to have this ongoing conversation offline with our network. And we would love to collaborate and see how we can amplify both the kind of work that you're doing around mental health and the communities as well. So I will keep in touch, and I hope that we can work again on doing more active work on the ground as well, and to continue sharing our knowledge. With that, I'd like to leave everyone today with a small quote from from fisherman I once spoke to. And he said, "Every day we face death when we are at sea. This is why we celebrate life so gregariously when we reach the shore. To the world, we are irresponsible spenders, but each day we live to face death another day. The man at the office does not understand this." So this is a reminder on perspectives. Have a great day ahead and a great evening ahead to everybody. Thank you so much. Bye-bye.